Good morning, members and staff members and representatives from all of the different organizations that we have today. Let me take this opportunity to welcome everybody for availing themselves to attend the Portfolio Committee virtual meeting. A special welcome to the Deputy Minister, who is, I believe, with us this morning as well. Before we proceed, can I please ask Masikole, the committee secretary, can you please project the agenda for the day for adoption by the members? And then if we can just have the agenda. There you go, members. You will see that we have a briefing today by GEMS, the Government Employees Medical Scheme, and also a briefing by the National School of Government, whereafter we will have an opportunity for deliberations. That will be followed by a briefing by the Centre for Public Service Innovation and also the Department of Public Service and Administration at 11:30, followed by more deliberations. So we have a tightly packed schedule today. Honorable Kaba, I see your hand. Would you like to move for the adoption of this agenda?
Yes, thank you, Chairperson. Good morning to you and the members in the platform, all the department of the DPSA. Chairperson, I rise to move for the adoption of the agenda. Thank you.
Thank you very much. Honorable Langa, I see your hand.
Good morning, Chair, and thank you very much. And greetings to colleagues and all the entity leadership. Chair, I am seconding the agenda. However, maybe for future purposes, Chair, I feel maybe if we could start with the department, because then all the other entities come after, or they are overseen by the department, rather than the department being the last to present. However, having said that, I do second the adoption of the agenda. Thank you very much.
Thank you so much, Honorable Langa. Your suggestion is duly noted. Members, with that, then we can proceed. The agenda has been duly adopted. We can proceed to apologies. Members, I did receive a verbal apology yesterday from Honorable Letlape. He is in the Health Committee today, but I've received no other apologies. Is there any other apologies that needs to be noted? If members can just raise their hands and let me know.
Thank you, Honorable Chairperson. There are another apologies for Honorable Ndamase is attending other committee, a standing committee.
Okay, good. Thank you very much for that. Duly noted. Members, any other apologies to note?
Just to say that the health meeting was cancelled.
Oh,
so I have joined. Good morning, Chair.
You are most welcome.
They cancelled the health meeting overnight. Thank you.
Okay, great.
Chair,
members, yes, Honorable Langa.
And Honorable Ndamase, being a procedural person, he should know that apologies are submitted via the Secretariat. So I thought I'd just share that. Thank you, Chair.
Thank you, Honorable Langa. Members, I think that concludes then the apologies, if there are no others to note. Before we move on and I make some opening remarks, I would just like to, from my side, also just make sure that all the delegations from the different departments of DPSA is welcome. So welcome. We look forward to your presentations. And then I would just like to mention and welcome two new alternative members to our committee. The ANC has deployed Honorable Mutolo as a alternate member from the ANC to our committee. Welcome very much, honourable member. I hope that we will get to meet you physically in our next meeting. And then a well-known member, Honourable Muatwe from the EFF, has also been appointed as an alternate member for the EFF to this committee. So we have two new alternate members. If members recall, an alternate member has full voting rights when the other member, the full member, is not present in the meeting. So they can attend all our meetings. They have all the same rights as we have as full members, except they can only vote when their full member is not able to do so. Then they can vote and take part as well. So with that, Honorable Mwatwe, welcome, and Honorable Tolo, welcome. We hope to also see you physically at our meetings in future. Members, with that, I think I can just make some opening remarks. The money bill, sorry, is there somebody who opened their mic? Okay, no, doesn't seem that way. Honourable members, the Money Bills Amendment Procedure and Related Matters Act 2009 requires committees of Parliament of South Africa to conduct regular reviews of both the financial and non-financial performance of their respective departments and entities, and, where necessary, to make recommendations regarding the forward use and allocation of resources. In line with this responsibility, the purpose of today's meeting is for the committee to receive briefings on the first, second, and third quarter performance for the 25-26 financial year from the Department of Public Service and Administration and its entities, namely the National School of Government, the Centre for Public Service Innovation, and the Government Employees Medical Scheme. The purpose of these engagements is to allow the committee to assess progress made in the implementation of planned programs, evaluate the utilization of allocated resources, and identify areas that may require corrective action or further support. So, without further delay, members, I will now invite the Deputy Minister to provide the committee with some opening remarks on developments within the sector, and thereafter the respective institutions will take the committee through their presentations. Deputy Minister, the floor is yours.
Chairperson, thank you very much, and good morning to the members of the Portfolio Committee on Public Service and Administration. Of course, it's going to be a marathon day because we have to present reports of the past 3 quarters, and over and above that, the center of this reporting is the priority that we are responsible for, capacity of the state to deliver. Of course, as we'll be presenting, I know the committee will also be concerned about how far we are going as the department on issues of filling of vacancies, in as much as we may be below the required percentage in as far as filling of those vacancies are concerned. It will always be a cause for concern for the Portfolio Committee, given the challenges of unemployment. But we'll work very hard, and we should be showing probably the next reporting how far we are dealing with issues of filling vacancies, not only for DPSA, but all our entities. That's one of the things. And I think as we'll be presenting, you'll also be wanting to know progress, especially on what is confronting GEMS with regards to its affordability and other related things. And I think the chair and the presiding officer will be there to be able to deal with some of the things. And I wouldn't want to really go into all the challenges we're going through, but I would want to also indicate to the Portfolio Committee that as we sit, we have the GTOs, the Government IT Officers Council sitting, because we now want to really integrate and move from the silo operations, especially in as far as ICT is concerned, because we believe that part of the capacity of the state is to modernize government and to make sure that we integrate IT systems that can help us. So, in a nutshell, we will be coming back to the portfolio committee just to show on how we're improving and making government to realize the capacity of the state to deliver. So let me not take you one by one on these issues, but let's allow the entities. I'm not sure if we're starting with James or we're starting with DPSA in as far as the member has asked, but we have men and women in all those entities who are on the platform who are going to be able to report. I'll be ready for certain interventions if the portfolio committee wants. And I can see you are aware I'm on the road. If I get cut off, I'll always come back into the system. Thank you very much, Chairperson.
Thank you very much, Deputy Minister. We appreciate that you have made the time. We can then move on, members, to the first presentation by, I believe, James, by the Government Employee Medical Scheme. James, are you ready to proceed with your presentation?
Chairperson, where are you?
Can you
Where's
not hear
the
me?
chair of James? We can hear you.
Okay.
Can you hear me?
Yes.
Yeah, please.
Okay. Can I proceed, Chairperson?
Yes, please do. Thank you very much.
Okay. Thank you very much, Chairperson. Honorable Chairperson, Mr. De Villiers, Honorable Deputy Minister of Public Service and Administration, Ms. Pinky Kekane. I did not see the minister, but I will, in this regard, do acknowledge that we also would like to express our greetings to the Honorable Minister, Baba Umzamo Buthelezi. Honorable members of the Portfolio Committee, the special advisors to the Minister of Public Service and Administration, colleagues from the Department of Public Service and Administration, ladies and gentlemen, good morning and thank you for the opportunity to brief this committee today. My name is Dr. Nomzamo Tutu, the chairperson of the Government Employees Medical Scheme, GEMS. I am joined today by my fellow members of the Board of Trustees, the deputy chairperson, Dr. Mpho Rabada, one of the trustees, the trustee, Mr. Siya Tsengiwe, and the trustee, Mr. Rapia, Alvin Rapia, as well as the scheme's executive leadership team, which are led by the Chief Operating Officer, Dr. Vuya Kola, the Chief Financial Officer, Ms. Karina van Lingen, and the Chief Strategy Officer, Ms. Masingita Chabalala. As a scheme, we appreciate the opportunity to brief the committee on the scheme's performance for the 2025 financial year. I must at this point mention that our financial year ends in December 2025, in December, and it starts from January until the end of December. We appear before this committee at a time when healthcare systems globally and here in South Africa are under increasing pressure. Healthcare costs continues to rise. The burden of chronic disease is also increasing. The utilization of healthcare services is growing and our members require more complex care. And at the same time, public service employees themselves are experiencing real economic pressures, and we recognize that affordability is a critical concern. The recent process and memoranda received from the organized labor reflect those concerns clearly, particularly around the contribution adjustments and the need for transparency regarding the scheme's financial position and cost drivers. As the leadership of the scheme, we want to state unequivocally that these concerns are heard and they are taken very seriously. The role of the Board of Trustees is to protect the interests of the members, not only today, but also into the future. And that responsibility requires us to make decisions that ensure that the scheme remains financially sustainable and that the members continue to have access to essential healthcare benefits and that the scheme remains stable in an environment of rising healthcare costs. In this regard, the contribution adjustment implemented for 2026 was not taken lightly. It was the outcome of a careful actuarial analysis and regulatory oversight, including the approvals by the Council for Medical Schemes, CMS. The intention behind these decisions is not to place additional strain on members, but rather to protect the long-term sustainability of the benefits we rely on. GEMS continues to fulfill its mandate of providing affordable and comprehensive healthcare cover to the public service employees and their families. Despite a challenging economic environment and the pressures within the broader medical scheme industry, the scheme has continued to demonstrate stability and growth in membership. However, like broader healthcare sector, GEMS faces several challenges, including the rising healthcare costs, an increasing prevalence of chronic diseases amongst the beneficiaries, and the ongoing need to manage fraud, waste, and abuse within the healthcare system that we see happening also in GEMS on a big scale. Financially, the scheme remains in a sound position. However, the upward pressures of claims, particularly the hospital costs, requires ongoing management interventions to ensure that the long-term sustainability and to protect the interest of the members. The purpose of today's presentation is to provide the committee with a transparent overview of the scheme's performance during the 2025 financial year and the steps we are taking to ensure that GEMS continues to serve the public service employees effectively and responsibly. This includes the scheme's financial performance, the healthcare cost environment and claims experience, the disease burden affecting our members, and the strategic interventions that are being implemented to ensure that the continued sustainability of the scheme. With that context being provided, I will now invite our Chief Operating Officer, Chief Financial Officer, and the Chief Strategic Officers to take the committee through the presentations that we have prepared and provide a detailed overview of the scheme's performance and the key issues before us. Thank you, Chairperson. Chairperson, on that note, can I then invite our executives to do the presentation? Thank you. Dr. V.
Thank you, Chairperson, through you. I am going to start us off on the presentation, Chairperson. My name is Vuyokola. I'm the Chief Operations Officer at GEMS. I will take us through the first part of the presentation and hand over to my colleagues as Dr. Tutu has mentioned. Chairperson, good morning. I will observe the protocol as the Chairperson of GEMS has already observed, but good morning to you, Chairperson, and the honorable members of the committee. And good morning to the Deputy Minister as well as the colleagues in the Department of Public Service and Administration. Chairperson, the purpose of this briefing is to the purpose of the briefing is to of this presentation is to brief the committee on the performance of GEMS in the 2025 financial year. As the chairperson of the board has already stated, the GEMS financial year spans from January to December. So the figures that we are presenting are based on those months within the financial year. The A focus of the presentation, Chair, will contain matters relating to the annual performance plan as well as the overall financial performance. Chairperson, I would like to first start by saying that we are sharing the indicators at a glance from a GEMS perspective. My colleagues and I will go into more detail. By the end of 2025, GEMS had registered a total number of principal members to the tune of 889,000, just over 839,755. And this then amounts to a total beneficiaries, which includes the dependents of just shy of 2.4 million beneficiaries in total. With regards to the claims that we've collected, we collected a total, so we paid a total of 67 million claims. This is against contributions of 65 billion. So that then resulted in a net deficit of 916 million overall. When we closed the year 2025, we ended the year with a reserve ratio that is just shy of the 25%, which is the statutory requirement. Our non-healthcare expenditure, meaning all the operational costs and head office costs that are not related to health, remain low at 5.56%. With regards to the annual performance plan that we'll be presenting today, Chair, GEMS's mandate is aligned to the DPSA's priorities for the strategy period of 2025 to 2030, which is to improve the health and welfare of public servants, to create an enabling environment for productivity. So the KPIs that we will be presenting are focusing on specifically those areas that are aligned to this strategy. I will then hand over to my colleague, Ms. Masingita Chabalala, to then take us through the presentation with regards to how we've performed from an APP perspective.
Thank you so much. Chairperson, thank you so much for the opportunity to present our performance for the 2025 financial year. As highlighted, our financial year starts from January to December. So as my colleague, Dr. Vuyo has highlighted, GEMS is aligned to Program 3 of the DPSA's objectives for 2025-2026 APP, where the APP is to improve health and wellness of public servants, to create an enabling environment for productivity. We also note that DPSA is also responsible for making the public service the employer of choice through partly the provision of accessible healthcare services. As part of government employees' macro benefits, GEMS continues to execute its mandate while we align to Program 3 of the objectives. GEMS also directly operationalizes these objectives by ensuring that we provide affordable, accessible and comprehensive medical cover to government employees, operating as a strategic health and wellness partner to the DPSA. One of the things that we also want to highlight is GEMS is proactive in wellness management, which includes chronic disease management programs, mental health support, preventative care screening, and we've also implemented mental health initiatives that ensures that public servants are fit, they're present, and they're able to perform their duties, aligning directly to DPSA's productivity objectives. Next slide, William. So, Chairperson, from a summary perspective, we have 6 strategic objectives. Only 5 of those strategic objectives will form part of the submission, and these will be the ones that are aligned to Program 3 as highlighted. We'll also focus on 21 we have 21 rather key results areas. Only 9 will form part of this submission. Out of the 8 are priority strategic objectives. We have 48 metrics and targets. We will focus on 21 as part of this specific submission. From an overall performance perspective, Chair, speaking to the KPIs that we will focus on, of the 21 KPIs, 15 were successfully implemented, which constitute 71%, and then 6, which constitute 21%, 29% rather, these were not met. Next slide for you. So in terms of strategic objective 1, which to be an organization that is effective in communication and decision making, we are responsible in changing environment and strive to create value for our key stakeholders. So we've got various KPIs and that we measure through for this strategic objective. The first one, Chair, is the Industry Member Satisfaction Index. So this one is done by an independent consultant or company rather, where they look at on an annual basis, where they look at GEMS member satisfaction against other schemes. So from a monitoring perspective, we only monitor this on the last quarter when we have feedback from the Ask Africa index. From a target perspective, our target for 2025 was to meet the industry target minus 0.5. This is also a target that's influenced by the way that Ask Africa determines the matrix. So from an actual perspective, we did see a positive feedback based on the report that we got from Ask Africa, where we saw 64.7% an increase in average against the 64.02, which was the previous year. However, Chair, when we look at this member satisfaction index, we do consider the next index that KPI rather, that we monitor, which is more the GEMS initiated member satisfaction score. Our target is 85%, and which we monitor on a quarterly basis. Just to note, Chair, we can see that this is one of the KPIs that is lagging behind from a performance perspective. We ended up at 81%. So even with our own member satisfaction survey, we can see that the challenges that the members have on the ground, it is coming through in the way that we engage our members. And it is part of what we're considering in terms of the interventions that we will do taking forward into this current financial year. We also measure our GEMS initiated healthcare provider surveys. In this case, we also have an 85% target, Chair, and what we measure here is the performance of our providers in the way that they service our members. GEMS has over the years created initiatives and structures to be able to engage effectively with our providers. We also have quarterly engagements with our providers just to ensure that we continue to educate our providers in terms of our benefits and our member profile as well, so that the way in which they service our members is effective. We also created a unit called the Provider Liaison Office, which also supports as a continuous support to all the initiatives that GEMS has done over the years. From a priority satisfaction, one of the things that the board has also approved as part of implementing our strategy is a stakeholder engagement strategy aligned to our stakeholder policy, where we are looking at engaging. Our target was looking at engaging 60% of our stakeholders based on a benchmark that was determined. The primary reason for this was to identify the key stakeholders that we needed to engage over the way we execute our mandate. This includes members, providers, it includes the unions, it includes the employer. It also includes the relevant government departments that we need to engage with, including the Council for Medical Schemes as well, because we look at our stakeholders from a holistic perspective to ensure that, first of all, we open up the channels for communication, the channels for engagement, to be able to improve where we need to improve and emphasize where the positives have been experienced. The next one that we also look at is the administrative efficiencies, where we look at the quality of our administrative intervention. So in this KPI, Chair, we look at the way in which we service our members. There are various areas that we look into. For an example, the rate of the way we respond through our call centers, our walk-in centers, the rate in which we respond respond to complaints and any kind of correspondence and queries that our members would have. Our target, Chair, for 2025 was 90%. We ended up at 99%, which shows the positive in terms of the way that we service our members. We've also got certain initiatives that we have implemented as part of this. Some of them, one of them being the Service Management Forum, where we engage holistically with our service providers to ensure that our administrative landscape is efficient. Dr. Vuyo, next slide. The next slide linked to strategic objective 2, where we want to maintain the organization's position for financial strength while we're driving towards transformation and sustainability through organization of other capitals. Chair, here we measure 5 KPIs. Out of the 5 KPIs as presented, we can see that 2 of the KPIs we didn't meet, 3 of the KPIs we did meet. Chair, I won't go into details into the financial performance because this will form part of the CFO's presentation, who will provide extensive details on the specific KPIs. Next slide, Dr. Vuyo. In terms of strategic objective 3, where we support the progressive realization of universal healthcare coverage through solutions such as NHI, strategic purchasing, insourcing capabilities, and other key elements of an integrated and coordinated care. We focus on a compelling value proposition of products. The first KPI, Chair, that we monitor is the average percentage of product affordability. This is one of the areas that, if you look from a performance perspective, we can see that it is red. It is an area that requires intervention from our side. We do note the conversations that are happening around competitiveness versus affordability. And as the scheme, through the direction of the board, we are looking at how we can respond to this by doing detailed analysis and understanding of affordability in terms of our products. The next KPI speaks to increase in hospital admission rate relative to the previous year. So our target for 2025 was 2.3%. So in this KPI, what we're looking at is to ensure that our admission rate remains lower than the target. And I think as part of the CFO's presentation, there will be a lot more detail that comes into this KPI. But what we are picking up here is that our admission rate still remains lower than the 2.3% target. From an admission rate in terms of priority to chronic disease relative to the previous year, again, it's a 2.3%. Similar principles where we see that we as highlighted in the previous slides, interventions that GEMS has initiated to ensure that from an admission rate we remain lower than our target, including our disease management programs, health and wellness and preventative care solutions. From a percentage of health quality outcomes above industry average on predetermined health quality assessment matrix, our target was 50%. In here, we are talking about when we execute our mandate and we provide healthcare, to what extent when we compare to the industry, our outcomes are higher than the targets that we've set. This is an area that we have exceeded target. In terms of achievement for the World Health Organization linked to the management of HIV, sorry, Chair, I don't know, I seem to have something on my throat. So if we look at the management of HIV, we align to the target set by the World Health Organization, which is 95%, 95%, 95, which talks to issues around knowing your status and being on a program to manage your healthcare based on after knowing your status and you've tested. Over the 4 quarters, we have seen that there is still some work that is required. From quarter to quarter, we can see areas where we were lagging behind from a performance perspective, especially on the areas about knowing your status. But we see in quarter 1, quarter 2, and quarter 2 and quarter 3 and quarter 4, we've seen an improvement in terms of that specific target. Next slide, Dr. Vuyo. This is the last strategic objective that I will speak to, Chair. So one of the things that one of the KPIs that we measure is the number of members registered on the scheme as per the end of financial year. So our target for 2025 was 893,500 on principal members. We do see that in Q1 we did lag a bit behind in driving our quarterly target, but over the next subsequent quarters, we've seen quite a positive trajectory in the way that we've managed the specific target, ending the year above target, sitting at 898, 800,098 and 755. From a percentage of retention, one of the things that we pride ourselves is that once we have a member base, we need to ensure that we retain our members. This is through ensuring that our product is available, our service is efficient, and we engage our members to continuously communicate to them the benefits that they have and any queries that they would have. From a target perspective, we're sitting at 95%, and we are happy to announce that from a retention perspective, we ended up quite well at 99.7%. Overall, Chair, from a performance perspective, we can see that we are on the positive side of performance. However, we do note that the challenges we do face as part of the KPIs that we've highlighted that are red, and as part of the implementation for this current year, financial year, there are interventions that we're looking into to respond to that. Thank you so much, Chair.
Thank you so much, Mercy. I'm going to hand over to our CFO, Karina.
Thank you, Chairperson. Good morning, Chair of the Committee, DM, and other colleagues. So I'm going to take the committee through the financial performance of the scheme. As was mentioned, this is for the full financial year of the scheme, which starts on the 1st of January up until the 31st of December. So in terms of our statement of comprehensive income, the scheme has collected just over 65 billion in contributions. We also paid out 67 billion in claims, and we would note therefore that the claims paid out exceeded the contributions, and this relates to the claims ratio that I'll speak to in a moment, and the level of claims the scheme experienced during the previous financial year. In terms of our investment income, the scheme received very good investment returns for the financial year, and at an overall level, the scheme recorded a net deficit of just over 900 million for the year. This is better than what was budgeted for the 2025 financial year, and as the committee would note, a significant improvement from the prior financial year. The improvements relate to matters that the scheme implemented a number of interventions in the claims experience area. There was also a specific focus on fraud, waste, and abuse. And then, of course, the good investment income or returns supported a better bottom line. Next slide. In terms of the statement of financial position, the slide confirms the position of the scheme with total asset value of, apologies, just over 24 billion at the end of 2025. It also confirms the scheme's ability to pay its liabilities as they become due, and also holding reserves for members of just over 18.7 billion. Next slide. So some of the key ratios we focus on to look at the sustainability, financial sustainability of the scheme. The first one is the reserve ratio, as we are required by the Medical Schemes Act to hold 25% in reserves. The committee would note that the scheme ended off the 2025 financial year just short of the 25%. And this is informed mainly by the high level of claims that we experienced in the financial year. The liquidity ratio at 4.12 confirms the stability at a financial level for the scheme and its ability to pay all of its liabilities and claims as they become due. The ROI, or return on investment, reflects the returns we received on the investments held on behalf of members. A very good performance at 12.76% for the financial year. The claims ratio measures the claims that we pay in relation to contributions that we receive. As I've mentioned, the scheme paid more claims in 2025 than contributions received, even so for the prior financial year. We have seen a slight improvement, and I'll speak to that in a moment, but this is really the area of challenge for the scheme and where a lot of work and interventions have been implemented. The last one is the non-healthcare cost ratio of the scheme. So this represents the administrative and operational costs that the scheme pays to operate the business, and it represented 5.5% of the expenditure for the scheme, showing that the majority of contributions received is paid towards healthcare costs and not administrative costs. Next slide. So just in terms of the long-term forecast, where we are foreseeing at a financial level. So for 2026, we have projected a break-even position, following through in the next 3 financial years to then be in a positive or net surplus position for the scheme. The assumptions for 2026 is listed below, and these reflect CPI as well as healthcare inflation components, as well as utilization, which is the frequency at which members utilize healthcare services. So in short, the long-term forecast does show a positive outlook for the scheme in the next 3 financial years. So if we then just quickly touch on the area of challenge that I've mentioned, which is the claims ratio of the scheme at 102% for 2025. So the committee will note from this graph, historically, the claims ratio started increasing significantly above the industry from 2022 and 2023 and 2024. This has been a concern, and the scheme has worked really hard to focus on this area of challenge. It is higher than the industry. Some of the matters that influence this number, I know we've spoken previously about the low contribution increases that were previously implemented that did have an effect or a roll-on effect in a number of financial years. We also saw a significant increase in utilization. So in other words, the frequency that members visit healthcare providers or are admitted to hospital. An increase in fraud, waste and abuse, which has also been a focus area for the scheme. And then also in terms of option selection. So we've seen high income earning members joining options where very low contributions are allocated. And those options that were created specifically for the lower income members, where your high income members brought down to and created a lot of additional claims expenditure above contributions paid for those options. And all of those elements informed the higher claims ratio to contributions. Next slide, please. So in particular, over the last 2 years, we've seen a significant cost driver in terms of hospital admissions. So hospital costs make up the majority of the expenditure for GEMS. 37% of healthcare costs paid is for hospital admissions, and this increased from the prior financial year to 2025 at a rate of 1.7 billion rand. If we look a bit closer then on the next slide, what are the drivers for these admissions? It's specifically in the area of radiology, pathology, physicians, and clinical technology, and all of these had increased or the utilization of these areas in hospital were above what was expected for the financial year. So we've spoken about interventions that the scheme has implemented, and some of these interventions were implemented during the course of 2025. So this graph reflects on how we measure if these interventions actually make a difference and are achieving what we've set out to achieve. And as the committee would note, from Q1 to Q4, there is an improvement in the area of claims, which does support the fact that the interventions implemented are starting to yield results. And we are positive that that would continue and at the end of the day influence our claims ratio and ultimately the contribution rate that the scheme can implement. What is also important to note is that the scheme does pay claims, and for the majority of members, claims are not significant, but we do have claimants or members that claim significantly for healthcare costs in a financial year. So we're illustrating on this slide the top 10 claimants for 2025 on the right-hand side. The committee will note that for claimant A, for example, the scheme paid 11.4 million. For claimant B, the scheme paid 6.3 million. And if you see that in perspective of what an average member pays in contributions per annum, which is around 80 to 90,000 Rand per annum, and the scheme has paid 11 million towards your healthcare costs, one can understand that GEMS does pay for healthcare, and even so far beyond any contribution received from a particular member. On the left-hand side, we then just also illustrate that the majority of members, 94% of members, do claim less than 100,000, and 5%, or a small proportion of members, actually claims represent almost 60% of what GEMS pays in any particular financial year. So non-healthcare costs, these are the administrative and operating costs that the scheme pay in a year to operate the business of the scheme. We did in the previous meeting report on the 2025 costs. So we are showing today here the 2026 budget for the current financial year that we are in. Apologies. So the top proportion is the service providers that the scheme has contracted to deliver administrative services. So the cost of 3.8 billion is budgeted for that. Other operational costs, which is really at the head office level, is at the second part, where we also show staff costs, other costs, and professional costs. What is important on the right-hand side is to show that the majority of our non-healthcare costs, the 5% I spoke to, does go to service providers that we contract for administration and managed care services, and a smaller proportion is really at a head office level for running the office. A number of questions have been posed over the last couple of months in terms of insourcing administration, and it will be cheaper and more effective. So there are pros and cons in doing this. However, at the moment, it is clear that the outsourced model in terms of administration in particular is cost effective and does reduce the scheme's costs in terms of non-healthcare costs, having it outsourced for now. Insourcing these types of contracts will increase staff costs, it will increase technology costs, and other operational costs. And then lastly, just to reflect on the non-healthcare costs. So historically, as well as currently, the scheme has managed to keep these costs very low. What the 5% or the 5.4% really represents is for every 100 Rand that a member pays in contribution, only 5.44 Rand is used for administering and operating the scheme. The other 95 Rand or 94.6 Rand is utilized towards healthcare services and claims being processed. Thank you, Chair.
Thank you very much, Karina, Dr. V.
Apologies. Thank you, Chairperson. So in conclusion, Chair, the scheme does remain in a strong financial position and continues to operate as a going concern. We are experiencing an upward pressure on claims that are leading to a decline in our reserve ratio. In the chairperson's opening, she did mention that we are facing several challenges. These include the ever-increasing cost of healthcare, the increasing prevalence of chronic disease that comes with an aging population, which is expected for any medical scheme. As the scheme ages, the chronic disease prevalence is higher and the cost of healthcare then do rise. We are continuing to address the ongoing need for better management of fraud, waste, and abuse, which is an issue that is prevalent in the medical scheme environment. There are several claims interventions that remain a key priority to manage the negative claims experience, the overutilization, as well as fraud, waste, and abuse. I do have to say, Chair, that this is a fine balance between managing claims, fraud, waste, and abuse, but also making sure that we do not deny access to care for those members that need care. Our healthcare costs remain managed before industry average. The scheme does remain committed to maintaining our mandate. We are putting a priority with regards to member satisfaction that my colleagues presented on, where there is a need to improve the satisfaction levels with regards to what our members are saying to us and what they are not happy about with regards to things like contribution increases, for example. Chair, thank you very much. I will end here. I would, Chair, like to apologize because I omitted to provide an apology on behalf of Dr. Stan Mulwabi, the Principal Officer of GEMS, who is currently on planned leave, Chair, and is having a procedure. Thank you, Chairperson.
Thank you, Sir Chairperson. That is the presentation from GEMS. Yes, we do apologize that we did not tender an apology on behalf of Dr. Stan, who is currently on medical leave at home and recovering at home. Thank you, Chairperson. I'm handing it over to you, Chairperson. Thank you.
Thank you very much to the complete GEMS team for the good presentation. We wish Professor Stan also the best in his recovery. We hope to see him back in action, but the apology is duly noted. Before I give the members an opportunity to deliberate, we still need to see the Department of Public Service and the National School of Government third quarter performance presentation, and then we can deliberate. So with that, with no further ado, can I please hand over to the NSG for their presentation?
Thank you, Chair. Good morning, Chair and the honorable members. I just want to put my presentation. Sorry. In presentation mode. Technology is playing with me today. Let me do that again. Review. Apologies for that. I will get it right now. Okay, let me continue while I try and do this properly. I'm going to continue. Thank you. Thank you, Chair. As we want to greet the chairperson and the committee members, as well, honorable members, as well as the deputy minister. The presentation from the NSG is for the 3 quarters. We will cover the presentation, will cover the context of the NSG, what we have planned to do, as well as the performance in the human resource and the annexures that we will have. Just to remind the committee members again, the National School of Government is a department under the minister, reporting directly to the minister, and our mandate as a school is to provide education and training to individuals, support the institutions, foster collaboration, that means working with partners, and offer qualification, as well as work in the 3 spheres of government. And then we're also mandated to conduct training, examinations, and tests for those that are entering the public service, which we do through the Ngegela programs. When we look at our priorities, how we've aligned our work is that we do have aligned ourselves with priority number 1, capable, which is to drive inclusive growth and job creation. We are doing that by making sure that we've got the capability for economic governance. So we've got programs that will support that. And the priority 2 is reducing poverty and tackling the high cost of living. We've looked at where we can support the improved governance and social cohesion. And priority number 3, which is the core of what we do, is building a capable, ethical, and developmental state. We are looking at 2 priorities that we have as a capable and professional public sector, as well as in institutional excellence and leadership. Now, vision and mission is linked to priority number 3, where we're looking at making sure that our goal is a capable and ethical public sector. What we see that as a part is where we cultivate professional public sector capacity through education, training, and development that advance inclusive economic and social growth to the benefit of the society. Our highlights then, Chair, for the period in the review is that for revenue targets, we were able, for the 3 quarters up to December, we generated revenue of 110.5 million against a cumulative quarterly target of 54 million, which means we've exceeded our quarterly target for the up to 3rd quarter by 56.5 million. We've managed to train 88,187 learners on the compulsory and demand-led training against a cumulative target of 37,900 learners, which means we've exceeded our target for the 3 quarters by 50,287 students. Of that, we have 22,688 learners who have completed the ethics course. We have still some of those enrolled that have not yet finished, but they're in the pipeline. And then for Ngegela, we had enrollments of 4,263 by end of December. Those that had completed with 2,691. These are the people that are planning to apply for positions of senior management. Under ethical leadership and executive oversight programs, and ethical leadership and legislative oversight program, we conducted training with Mpumalanga provincial government as well as the legislator. Under the mayoral leadership and oversight program, we were able to deliver that program to Eastern Cape, Northwest, Northern Cape between September and December. The NSG also, working with Chandler Institute of Governance, organized the launch of the 2025 Chandler Good Governance Index, and we held the roundtable to discuss the index and strengthening the dialogues of governance indicators across the continent. We also were able to facilitate 11 officials from the various authorities and local government sector to be able to attend a capacity building program on water and waste management, which we co-organized with Singapore Cooperation Enterprise. And then we also have 25 other officials also attending a short learning program on professionalization and modernization of the state in China. With AMDIN, where we work with other African schools of government, we're able to host the conference in Ghana on the 28th to 29 April under the theme Enhancing Governance and Public Administration in Times of Polycrisis through Collaboration, Policy, Evidence and Technology, that is AI, and innovation for public service delivery. So working on the second AMDIN conference that will be in Namibia, that will be held in May. We're also working with Microsoft and NEMISA. We had a partnership on digital skills. We were able to train 1,834 learners, and we are currently in progress, and we had 411 that have completed the courses. We've also launched a new webinars that has started yesterday, and we've seen quite a big interest on the use of AI when it comes to the work of the state. Also, the highlights when it comes to e-learning, we have enrolled people on the different programs that are there, about 115,604, of which 64,163 completed the programs. Some of the programs are addressing the core competencies that you need to have, especially in senior management, as well as in any level, actually. Those are financial management and budgeting, leading change, policy formulation and implementation, project management, strategic human resource management, and strategic planning and management. Those are some of the core competencies that are required. We also have the ones that for financial management delegations as well. So we've seen quite a lot of interest. As I mentioned, the ethics tops the numbers as usual. Highlighting the programs that we've done under the socio-economic development, we're able to train CDWs, around 277 people that were trained in different provinces as well. We've seen in Mpumalanga, Eastern Cape, KZN, Northwest, and Northern Cape as well, as well as Free State. Under the socio-economic development under traditional leaders, we were able to train Contralesa, and we had 28 people attending that program. We've continued in this new quarter, which we'll share next time when we talk about the fourth quarter. Highlighting the youth training, we've trained 1,156 youth on the BB2E, which is Breaking Barriers to Entry program. We also trained 4,045 youths under Personal Mastery program. And on the Mandela Day, we invited schools, grades 11 and 12, where we did a specialized personal mastery workshop, and 155 students were able to attend and get equipped on self-mastery, which covers personal mastering emotional intelligence, as well as preparing them on how to prepare their CVs and so on for the work environment as well, and preparing themselves for the universities. Under cadet and youth programs, which is an 18-month program, we had 20 enrolled on that. We, in partnership with Africa Leadership Academy, were able to host an ethical leadership and governance workshop, which brought 10 youth from different African countries into South Africa, and we were able to host them in 1 day in one of the modules that they required. And we had a youth symposium where we had 560 youth attending that program. Working with the NYDA, This year, we were able to increase the number from, in 2024, we trained 247 learners from all provinces. In 2025, we trained 279 learners on this program of personal mastery, which we provide for free with the funding that we got from National Treasury on rolling out certain programs for free. Other highlights is the partnerships that we're able to establish. We were able to sign an agreement with Guangdong Institute of Public Administration, which will allow exchange of learners as well as exchange of the experts to be able to help us in developing the public servants. We also, in partnership with Public Service Commission, we co-hosted the inaugural Professor Stan Sangweni Memorial Lecture, which was very successful, which looks more on the ethical leadership and promoting ethical behavior within the public service. In this year, we also launched a leadership program reframing the role of men in transformational leadership, which our minister was able to honor and open that program for us, which is the first of its kind, trying to introduce men in their responsibility of driving the transformation agenda within the public service. We also were able to host the Global South Dialogues with China, where we explored the role of media and public institutions in advancing democratic governance. These are some of the highlights. And on the issue where we've got a target to train board members, we inducted 50 board members from the public entities under the Department of Human Settlements, and it was very successful. We also held various webinars, maybe to highlight the ones that are focusing on digital skills and AI, which we had a good turnout with the enrollment. And we, as I mentioned earlier, we have ones that are scheduled for the next few weeks, few months, having started yesterday on AI, and we've seen very good interest from public servants wanting to know more about AI and how they can use it in their work. Now, to talk to the first and third quarter performance, in quarter one, we managed to achieve 92% of our targets, with one target that was not met, which was the revenue generation indicator, where we were able to raise 16.2 million against a target of 25 million. But with the cumulative target, we're able to then correct that, and we were able to achieve 100% of our quarterly target for quarter two and the third quarter. We've seen an increase in the uptake of the training, and we see that even though we're not fully in the office because of the renovations that were being done by the landlord, we still were able to achieve our targets through that period. We are now back in the office, and everything is going as planned. And now, highlighting the financial performance, we have a total budget on our vote of 226.6 million as our budget, and for the up to December, we were supposed to spend 170.5 million, and we're able to spend 97% of that budget, where we spent 165.4 million. Under the underspending there is under administration, which is mainly through goods and services, which we know will pick up in the last quarter four, and we'll be able to achieve that, as well as the capital assets, where the delivery is set to happen in the last quarter. Under the trading account, we were able to do the transfer that they needed, the 83.8 million. And on the training revenue, as mentioned, we're able to surpass our target of 80.1 million, and we surpassed that. Our goods and services are linked to the actual training. If you have more training, you'll have more input costs. So we had a deficit of 3 million there, which is positive because what we had expected was a higher one. So we are very excited that we're able to raise more income during the period. Under human resource oversight, the NSG has a total of 238 posts in the structure, of which 217 are filled, and we have 21 vacancies. The vacancy rate is sitting at 8.8%. Of the vacant posts, 4 are at SMS level and 16 are non-SMS. A lot of those posts have been advertised. We're in the process of making sure that those posts are filled. Some of them, as you know, as the year goes, people will be resigning, then it has an impact. As you've replaced, someone is leaving again. The demographics for the school there were 87% African, 5.6% white, and 4.6% colored, and 2.3 Indians. When we look at the employment equity, the gender, where we have females in the NSG are 58.9%, and in the SMS level, they are 52.3%. Under the youth, we have 23.5 youth in the National School of Government, as well people with disability are sitting at 3.2%. Chair, we have included in the presentation the annexure which looks at the performance tables and lists all what we have achieved. But since we've achieved our target, I will request the Chair to allow me to stop my presentation there and we can engage. Thank you, Chair.
Can I just make sure, is there no further speaker from the NSG?
No, Chair, I covered the whole presentation. Thank you, Chair.
Thank you very much indeed. Members, we are now at 11:15, so that's 15 minutes past our target time. Honorable Kaba has sent me a private message making a suggestion that perhaps we must view the other two presentations as well. So the briefing by Public Service Innovation and also the Department of Public Service and Administration, and have one deliberation session at the end, which effectively means that we will now not deliberate but push through with two more presentations and then give a final. Members, is there any objection from any member to that amendment of the agenda? Honorable Tkelisi, I see your hand. Please proceed.
I object, Chair. There will be a lot of information that we'll have to remember. I think these two are enough for us to deliberate on them, and then we can take the other remaining two. Thank you, Chair.
Okay. Honorable Tkelisi, Honorable Spies, I see your hand as well.
Yes, good morning, Chair. I actually tend to agree with Honorable Kalishe on that one. I think if we can handle the questions on the two presentations in good time, we can then proceed with the last one. Thank you.
Okay, thank you very much. Honorable Langa, I see your hand.
No, thank you, Chair. Mine was also to concur with the previous two members. Chair, we adopted the agenda. So if we've adopted it, it means we all know what that means. So I will also second that we stick to the agenda. Thank you very much.
Members, that's fine. If we are if you are uncomfortable and you feel you have important questions now, then I'm happy that we stick to the agenda. I would just like to point out, Honorable Langa, that even if we adopt an agenda, that midway through, if the whole committee is in consensus that we can change a point, that we are able to do that. But this is exactly why I asked whether members object, and seeing that 3 members have already objected, I will now make a ruling that I think it is better that we deliberate and waste no more time. I will just, from my side as chairperson, ask members Because we still have two presentations left, if we could perhaps be short and to the point in our answers so that we can be as effective as possible. With that, members, I'm going to open the floor for deliberations, and I will take hands as they are shown. Honourable Spies, your hand is first, so you can go, and then we will follow with Honourable Mkunu after that, and Honourable Pulwani after that. Thank you very much. Honourable Spies, please proceed.
Thank you very much, Chair, and allow me to appreciate the presentations that was done. My first questions will be on GEMS, so, Chair. And Chairperson, I think it's important because GEMS plays a very critical role when it comes to healthcare coverage for public servants, and I think as a committee we really need to interrogate both its financial sustainability and governance. And in this regard, Chair, I want to just obviously start with my first question, and that would be on the financial sustainability. We know that the scheme has reported that the annual contributions versus the claims that has been paid out, and as we could see, that exceeds the contributions. And so I would like to understand, Chair, how the scheme is able to sustain paying out more in claims than it receives in contributions. And then in that same vein, I would also want to know what are the primary drivers behind the increasing claim costs, and which benefit options are contributing most to this trend. And then the last one, still on the financial sustainability, is that I want to understand what GEMS has done to address this imbalance. And can the scheme for members in particular, can we confirm that these measures will not place additional financial pressures on the members of GEMS? Chair, I've seen that there is a positive member satisfaction result. Now, I can tell you, many members have a lot of frustrations. I have parents who are both retired professionals, public service, and have found it very difficult to access and make contact with regards to query. So I want to know from James is that um, who conducts these surveys, and are they independently verified? And have James actually commissioned an independent external evaluation of member satisfaction? Because what is said here is not the lived experience of members on the ground or out there. And then, Chair, just on membership, then I'll be done on this one. Is that I want to understand what specific factors has driven the growth, and how much of this is due to new public service employers versus members transferring from other medical schemes. I just want clarity from you, Jay. Should also on terms of my questions for the NSG, or can I just maybe stop there?
No, please proceed with your NSG questions as well. Thank you, Honourable Space.
Okay, thank you so much, Jay. I'm just trying to find my questions.
Honourable Space, you're not audible. You've muted.
Okay, sorry, Chi. If you can just quickly just maybe skip me for this. I'm just having technical problems because I need to just access my folder here. Thank you.
No problem. I'll give you an opportunity at the end again. Honourable Mkunu, you have the floor.
Greetings, Chair, and everyone in the meeting. Firstly, I would like to welcome the presentations from GEMS and NSG. Yeah. Maybe let me just shoot straight to the questions because of time. The first one is the hospital costs alone account for 37% of total claims and increased by 1.7 billion in 1 year. What specific intervention are being implemented to control hospital costs and prevent
over servicing by providers. The other question is under fraud and corruption. Yes, a medical scheme globally loses billions of rands each year due to fraud, waste, and abuse. What is the total financial value of fraud detected within GEMS over the past 3 years, 3 financial years, and how many of these cases resulted in criminal prosecution rather than only internal disciplinary action? And the other one, many public servants have raised concerns about limited access to specialists, delays in authorizations, and administrative barriers when accessing healthcare services. What concrete measures in GEMS implementing to improve healthcare access and reduce delays experienced by members? Healthcare costs are rising rapidly worldwide. What long-term strategy does GEMS have in place to ensure that the scheme remains affordable and financially sustainable for public servants over the next 10 to 20 years? Let me proceed to NSG. Okay. My question is, okay. The presentation indicates that several positions remain vacant due to resignations. How many critical vacancies currently exist within the NSG, particularly at the senior management services SMS level? What progress has been made in advertising and filling this vacant post, and what are the expected timelines for concluding these appointments? Are there officials currently acting in this SMS position? And if so, how long have they been acting in these roles? Prolonged acting appointment often weaken institutional stability and accountability. What concrete measures are being implemented to ensure that these positions are filled permanently without further delays? The position of principal of the National School of Governance is a critical leadership role. What is the current status of the recruitment process for the principal, and when can the committee expect the appointment to be finalized? The last question. The National School of Government was established to professionalize the public service and strengthen the capacity of government institution. However, many departments continue to experience serious challenges relating to weak governance, limited capacity, and poor service delivery. What tangible evidence can the NSG provide to this committee that its programs and interventions are making a measurable and meaningful impact in improving the effectiveness and professionalism of the public service? Thank you, sir.
Thank you very much. Honorable Pulwane, you are next. Please proceed.
No, thank you very much. Let me greet you and the honorable members, our DM, our support staff, everyone, all the presenters, without waste of time. And I join my colleague by welcoming all the presentation. Chair, I think we as public service, we are a good example in terms of representative today. I think we are complying in terms of employment equity because I think it's we are led by women today, all the presenters. Chair, let me start with the GEMS. All the presentations from GEMS, they always speak about fraud, abuse. It's always there in the presentation. I've got only one question there. I just want to check if what current strategy are being implemented to minimize this fraud and waste within the scheme. And then the other thing, if the medical practitioner are found to have committed fraud on the abuse within the scheme, are such cases referred to the Health Professional Council to South Africa for disciplinary action? If so, I think they will be they won't come here and complain about this fraud and abuse. Let me go to the next one. This one, Kitabaholo, 2026 member contribution increase. If I hear well, they speak about a 9.5% increase. Maybe I may ask what additional factors inform this increase? For information, James, members are complaining about the services. Even the chairperson in her remarks, he already mentioned it. I know you will give your reason, but we are here representing the people. I just want to suggest, Chair, through you, that let's write to the minister for the coming 14 to 20 days to come and explain about this increase. Because they speak about affordability, but at the end, they don't mean it. So that's my concern, Chair. When I come on this thing of contribution of increase, I become angry, Chair, because James is aware that our people are not can to contribute that percentage. That is why they go up and then they decided to come down. So I think it's all from James. Let me touch from the National School of Government. On this one, all of us, we are aware that people are complaining about the government employee, their behavior. But I want to check, after they attended the ethical leadership, there are feedback mechanisms in the place within the National School of Government to track the behavior and change and the performance or the improvement of our employee. Up to so far, how many provinces have enrolled in the ethical leadership and legislation over the program? I hear they mention only 2 or 3. So I just want to check if there is a specific number of provinces. And the one of managing performance in the public service, is this course not compulsory for all senior managers? Because according to my understanding, it must be compulsory to manage the performance of the managers. Thank you, Chair. For now, I'll stop here. Maybe I will come back again. Thank you.
Thank you very much, Honorable Polwane. Honorable Kelise, it's your turn. Thank you.
Thank you very much, Chairperson. Good morning to you. Good morning to the Deputy Minister and colleagues in this meeting. Chairperson, I would have loved, I think we raised in our last meeting the importance of the minister to attend these meetings. I raised this because, not without acknowledging that the Deputy Minister is here, but some of the issues we want to direct at him, and he's never here. And I hope, Chair, he does get the message that he needs to attend our meetings, because we need him here to account on certain things. Chairperson, the last meeting we held with James, we raised a number of concerns, which some of them I would love to pick up on. You know, one of the things that we raised was that whether James is aware that it is serving, its mandate is to service our people. You know, it's that of it is supposed to be a public service vehicle for affordable quality healthcare. And we did point out to them, together with the labor organizations that were present that day, that they have become not available for the people. They boast about contributions, right? And I remember they boast about the contributions being lower But the PSA report did show that 13.5 increase is crashing the members of the scheme. And we've seen that because there were demonstrations on the streets. There were interviews done by these people saying that you are crashing our pockets. We can no longer afford gems, which now means that it's not serving the mandate of why it was established in the first place. And I see the presentation that is provided to us by this board and team of gems is that nothing talks to that increase. And this is happening while the scheme holds billions, Chairperson, in reserves. This is the accumulation of capital extracted from the pockets of workers who are already struggling, because their salaries are not increasing. This is something that they're not even taking into consideration. So they've got massive billions in revenue and significant reserves. And we ask them, right, why is there a need for increase when they've got billions in reserves? Because, and also another thing that came out of that meeting is that they are enriching themselves because their salaries are fine and the reserves are there. Why is there a need? And we never got an answer to that. Why is there a need to abuse our people by making them pay when you've got money? Because it's not like you were established for profit. You were established to service our people, and people have been screaming to say that we cannot afford, but nothing is being done. So maybe we need a new board that will listen to the people, because this one is not. It keeps taking from the people who have nothing to give. And another issue that we raised, Chairperson, in that meeting, because I go back to these issues, Chair, because we shouldn't be a committee where people and entities come to this meeting and they raise issues, they present to us, we ask them questions, but there's no one to account. They come back the next time with a different presentation. They present to us, we forget about what happened in the previous meeting. We need to know what happened. Why are you doing what you are doing to our people? Because we asked you, why is there a need to increase when people's salaries are not increasing? Another issue we raised, Chairperson, here is that we had 3 names of the board, who continue to be employees of the Department of Health. We brought evidence in the form of the integrated report that showed that, these 3 members were being paid millions. They are the employees of the Department of Health, and for them to be part of the board, the minister has to give a go-ahead. I did write questions to the board, and they did respond to me. I think Marcy did send this to all of us. Question 9, I asked if there was a written approval from their employer, which is the Department of Health, for them to hold and be remunerated for the positions on the GEMS board, right? In compliance with the Public Service Act and the Public Service Regulation. And the response that they're giving us as this committee, Chairperson, is that in the course of the vetting process, the scheme received the RWOP approval for both Ms. Njane and Ms. Kumal. And if that is the case, because my understanding is that approval needs to be given by the minister, they need to make that approval, they need to submit us with that approval. They need to make it available to us, because that approval, it can only be authorized by a minister. We want to know which minister approved that. We want to see that, Chairperson. I want to ask, you see, if the minister was here, I would then ask him what he's doing about the board that is defrauding, the state, because it's defrauding the state. We've got 3 members here, Chair. Ms. Koninchane was paid 8 million rands in the past 5 years. Ms. Lebu Khumalo is 7 million, and Dr. Rabada, which I learned in this meeting, that is now the deputy chair of the board, was paid about 2 million, which is 1.6 million, about 2 million. And we need to know who authorized this. Is the minister even of this committee aware as the employer? Because the minister of this committee is the employer. Is he aware that he's got people who are full-time employees but getting money as board members? Who authorized that? Can that be made available to this committee? And we're sitting with the chair of the board here, who's aware of this information, by the way, chairperson, and which makes me wonder if then the chairperson herself is corrupt. And maybe I should ask her that question. When they respond to our questions, she must answer and tell us if she is corrupt or not. Because how do you sit in the board with the people who are defrauding the states, getting millions of money when they are not authorized to do so? I think my other question, Chair, would be for the minister to follow this up, because we did. So my other question to them, actually, it's their question 3 of the responses that they gave me. I asked them to provide, because then there was no clarity. I asked them to provide the attendance registers and minutes of the meetings that reflect the participation of Ms. Ntsane and Lebu Khumalo. And here, Chair, I wanted us to establish whether these board members were attending those meetings. And as full-time employees, how were they attending those meetings? Bathini emsebenzini wabo. When they leave to go these meetings, bathini to the employer, because they are employed people. So that they respond to say, Ms. Ntsane attended 17 board meetings and 18 committee meetings. And Ms. Khumalo attended 16 board meetings and 18 committee meetings. And we still want to know, what did they say to their employer as they attending all? Because this is a time and money of the state. This is time and money of the state. So I need to know from the minister if the minister is aware, and he must also tell us if he's been aware of these payments and what is he going to do. And we need timelines of these things. Is he going to do? He must do an investigation himself. He must do an investigation himself and tell us, the outcomes and what he is going to do as the Minister of the Public Service and Administration. Chairperson, as I conclude, I won't go to NSG because of time. The report says GEMS increased contributions by 9.5% this year, which is the highest in the industry. They mentioned that costs are going up, but the reality is that, which is something they should be aware of and be sensitive to, workers' salaries are not going up by 10%. How are they justifying making healthcare so much more expensive for people, for nurses, for the police? How when they just take home, when their take home is barely keeping up with the food and electricity prices? Why are we having people like this who are not considerate? How do they inform their decisions? As people who are supposed to, by the way, their mandate is to look after these people, to make sure that they afford services that are otherwise unaffordable. They say the members pay 23% less for the same benefits. But if workers is paying 9.5% more and still has to deal with the limit, on what they claim, in the co-payments or medicine or not being covered, does this 23% less actually mean anything in their pockets? Does it mean anything? Are they actually getting better care at all? Or are they just, paying more for the same thing? And maybe, Chairperson, I think we really need to look at it like that as this committee. We've got a very arrogant board that is obsessed with making money while it is bankrupting our people. It must go. We must have people in those positions who are sensitive, who are aware and sensitive to the conditions of our people. If people have been occupying the streets saying that we can't afford, why are they increasing? And this is not a scheme that is bankrupt. They're sitting on billions. The last time I checked, it was 68 billion in reserves. Thank you very much, Chairperson.
Thank you, Honorable Kilise. Members, while I do appreciate that we have freedom of speech, and I don't want a culture where members of this committee don't feel like they can speak their minds. And I do understand that we represent voters and we represent different constituencies. I would just like to caution members if we say that, and Honorable Khaleesi, I have to make the example. If we say that a board has defrauded somebody, that's a serious criminal allegation, and I understand the feeling, and I think that you can convey that feeling without actually accusing the board members of criminal behavior. You can say it feels criminal, but to say without question that it is fraud, that needs to be handled in a different way. Then you need to provide evidence, go to the police, and open a criminal case. So, language is
Chair, come
important,
on, Chair,
members.
Chair. No, I don't agree. I don't agree. I say,
Honorable
Chair,
Honorable
Chair,
Khaleesi,
I
I'm on
made
the
a
floor.
point.
Honorable Khaleesi, I'm on
Chairperson,
the floor. Honorable Khaleesi, please,
please recognize
I'm on
me,
the floor.
Chair.
I will recognize you. I will recognize you. I would just need to ask you to please not open your mic. We need to maintain discipline in the committee meeting. And as chairperson, I am giving you I'm just asking for you to please not accuse someone criminally in this committee. That's all I'm asking. It's not an unreasonable asking, and I don't want to debate you on the issue, Honorable Khaleesi. I've not taken away your freedom. I've not taken away any of your rights. I'm just asking that you please not accuse anybody without evidence of criminal behavior. Honorable Khaleesi, I will give you an opportunity to say something, but please, I don't want to debate you on this issue.
Thank you very much, Chairperson. Chair, I didn't make a mistake by saying that the board is defrauding the state. If those people, they are indeed getting money without authorization that we are asking that be provided, it is defrauding the state. That's why we're asking, because I'm saying to you, it's public, by the way, the integrated report that is stating all these monies that they've gotten as full-time employees, that is defrauding the state. There's no other way of putting it, Chairperson.
Okay.
I didn't make a mistake. I say, here is an integrated report available. Yes. Here are the 3 names are reflecting there. If this is not the case, I invite them to make provision of saying this is not defrauding. These people are approved by the minister. And if that is the case, they give us the name of that minister. And I'm saying that letter, those approvals must be made available to this meeting, Chairperson. Please don't do that.
Okay. Honorable Khaleesi, I'm not going to debate you on the issue. I will then give the next speaker an opportunity, Honorable Langa, then Honorable Leklape, and Honorable Kaba, and then Honorable Spies at the end. Members, we are seriously running out of time, and I am going to be forced, because of the previous speakers who was very liberal with their time use, to ask you to please not go above 5 minutes, and to please make your points within 5 minutes. Thank you very much. With that, Honorable Langa, you are next up. Please proceed.
Thank you very much, Chair. Am I audible?
Yes, indeed, sir.
Okay. Greetings to the DM, the department led by Mr. Vogel, GEMS Executive, NSG Executive, CPSI. Chair, let me also welcome both presentations by GEMS and NSG. And Chair, I'm quite happy that you've covered the point in terms of allocation of time, because I'm looking at time now. It's 11:45, and we still have 2 presentations to take while we still need to deliberate on this. So maybe in future, Chair, maybe you will need to agree that we allocate members' time so that we keep within time, because otherwise the day becomes fruitless or non-productive when we are going to end the day without finishing the business of the day. Chair, my first questions will be to NSG. I had quite a few questions, but in the interest of time, I think we are still to have more meetings. I'll probably be covered then. if maybe not covered today. Maybe my colleagues, other colleagues as well, will ask those questions. So NSG on performance, the presentation indicates that the NSG generated about 110.5 million against the target of 54 million and trained 88,187 learners against a target of 37,900. So while this overperformance is commendable, how is the NSG ensuring that the rapid expansion in training does not compromise quality, relevance, and measurable impact of training programs on the professionalism of the public service? And number two, the NSG reports that 22,688 learners completed the ethics course and 2,691 completed the Nugela program, which are critical to building an ethical and accountable state. So from an oversight perspective, what monitoring and evaluation mechanisms are in place to determine whether these programs are actually improving ethical leadership and reducing misconduct within the public service? The last one for NSG, NSG has undertaken several international collaborations, including programs with Singapore and China. While international partnerships are available, how is the NSG ensuring that best practices from these partnerships are adapted effectively to South Africa's governance realities, particularly at provincial and local government level, where capacity constraints remain significant? To GEMS, I think it was Honorable Polwane who covered me on the increment one, so I will pass that one. Then on fraud, waste, and abuse, the presentation highlights that fraud, waste, and abuse could account up to 3 to 9 billion annually in South Africa's healthcare system. So what additional steps is GEMS taking to strengthen fraud detection, enforcement, and recovery mechanisms to ensure that public funds meant for healthcare are protected? On disease burden, I think the speaker touched on this. Maybe if she could further elaborate. The scheme notes that chronic diseases are driving healthcare expenditure, with conditions such as chronic renal failure costing up to 16 times more than average cases. Then how is GEMS strengthening its preventative healthcare and early detection programs to reduce the long-term financial burden of chronic diseases on the scheme? Maybe, Chair, let me pause there for now. There was quite a few, but in the interest of time, can I just pause there? And thank you very much, Chair.
Thank you very much, Honorable Langa. And I would just like to say thank you that you also said that some of the questions were covered and didn't create duplication. Thank you for that. Honorable Kaba, please proceed.
Thank you very much, Honorable Chairperson. Honorable Chair, because of the interest of the time, as Honorable Langa says, I'll just touch here and there. Mine it will be under the GEMS annual performance strategic objectives. The objective 1, the member satisfaction is below the target mark of 90%. The objective was not achieved. Objective 3, compelling value proposition of product. The accumulative progress has not been shown in the table, but it shows at the tail end that the target was not achieved. My question, Chair. If the increase of 9.5% is justifiable, which is more than the salary adjustment, does the scheme still value its virtue on accessibility and affordable? Chairperson, the scheme failed to meet its target on stakeholder satisfaction. The main stakeholder is supposed the members who overwhelmingly rejected the increase due to affordability. My question, Chair, does the non-satisfaction of the objective refers to the inability to meet members' demand? What is the value for money does the increase have for members? I thank you, Chair.
Thank you very much, Honorable Kaba, also for your time management. It is appreciated. Members, Honorable Tikana has indicated that she can't use her raise hand function, so I'll just give her an opportunity as well. Honorable Tikana, you have the floor.
Thanks, Honorable Chair. Good afternoon to the Deputy Minister, Honorable Members, the DG and all entities led with their heads and support staff. Honorable Chair, due to time, I limit my questions to a few areas. On the NSG, I'll go to the ethics course training outcomes. Of the 22,688 learners who have completed the ethics course, is the NSG system able to distinguish categories of employees who have attended the course and their levels within the public service in order to determine whether the training is reaching the intended employees, such as those working in supply chain management and other critical directorates within government? And who is responsible for measuring those employees? I understand that they are ethic officers, but I would like to inquire, are those ethic officers able to do their work? Or that will be informed if there's any feedback, which I believe there must be a feedback mechanism in place. If it's not there, they can detail to the committee how they can improve on that one. Then I'll come to the issue of the ethical leadership and legislative oversight programs. Understanding that the minister have launched a program, how many provincial governments and provincial legislators have enrolled in the ethical leadership and legislative oversight program? And is there a targeted time frame to ensure that all government leaders and legislators receive this training? There was also an issue of vacancy rate, Chair, which is a result of resignation and retirement. I believe that they have a schedule of employees who are to retire during certain time. And I believe that there must be no gap of time in employment, because if even 3 months before they know that someone would go for retirement, processes should unfold of advertising for that post. What becomes their plan when they already know? And also on issues of retirement, one gives a month notice. So I don't expect them to take more than 90 days in filling the vacancies. Unfortunately, they don't they didn't present to us on the time frame of the vacancies. But I so wish that they can give us time frame for filling of vacant funded posts, because I believe for those who are going for retirement and those who have are resigning, those posts were funded for. That will eliminate the chances of Treasury or redirecting the funds of the budgeted funds. On GEMS, Chair, I'm not comfortable about deficit. Possibly they will explain more, because my understanding is that when they plan, especially they have reserve, they should cover the money. Then I'm observing deficit as much as it has declined in the current 25 financial year, but for 24 was a large amount. They can take us through those processes. What will make the institution to be normal? Then, Chair, lastly, Chair, they are presenting the issues of investigation, the fraud, abuse, and waste within the institution. I understand and I believe they do have the investigation reports, but I also wish that they must take us off the process plan in implementing the outcomes of the report. And are they reporting the health professionals to the Health Professional Council? In the last meeting, Chair, they indicated that there was one post which was off the board, which was to be filled. I would inquire, because we welcomed new members of the board, which were vacancies which were filled, but there was one which was left. If they can take us through and inform us whether they have finally filled that vacancy. Lastly, Chair, is the issue of consultation of their members. As I have identified in their report that during the protest which was there, members were claiming that they are not being consulted. Is there a plan of membership consultation within GEMS? Thanks, Chair.
Thank you very much, Honourable Tikana. Honourable Space, I promised you a last bite. Can you can proceed?
Okay, now, yes, I'll just limit my NSG to questions to two, Chair. The first one, Chair, is the issue around municipal capacity. Now, we know that most of the serious governance failures occurs at a local government level. So I wanted to get an understanding from the NSG what training programs currently reach municipal officials and what targeted programs exist to address the capacity crisis in local government. And then in terms of the discussion that has been going on for many years, Chair, on the professionalization framework of the public service, I want to understand what progress has the NSG made thus far in ensuring that senior managers and director generals meet the minimum competencies and standards before being appointed or promoted. Thank you, Chair. I'll just leave it at that.
Thank you very much. Members, before I hand over to
Chair,
the...
I'm still here. I don't know what happened.
Honourable Eklape, sorry, your hand was lowered, so I assumed you were covered, but you can still go. Please proceed.
Okay, thank you, Chair. I'll just be brief. Just questions about the pressure of affordable health coverage to public servants that they speak of. Have they done an analysis on that? What is the average percentage of salary of take-home pay that goes to medical aid for members, and what is the projected affordability going forward? There's been reference to the issue of universal coverage through NHI. Can they just explain what they mean? Are they waiting to be taken over by NHI? Do they see themselves playing a role? What is their position in that regard? Because Section 33 talks about when NHI can deliver what medical aids were doing, medical aids will then cease to provide those services. Can they just explain where they are with that issue? Now, the claims experience which is rising, have they done an analysis of particularly frontline services? How much are they spending on primary healthcare? If you take doctors, for example, what is the expenditure on GPs? What is the expenditure on specialists? It goes back to the issue of, are you paying for prevention of disease and primary healthcare, or are you waiting for people to get into hospitals? A second last question. The reserve that is a prescript of the Act, what is it meant to do? When can you tap in on the reserves? Can it be used to bridge the gap of affordability, which might be transient or permanent? And lastly, they talk about fraud, waste, and abuse. How many providers have been successfully prosecuted for fraud? Because fraud does not go to fraud is a criminal offense and does not go to professional people. They can be dealt with after the fact when the legal system has worked with them. And in terms of waste, what are the waste areas and what are the plans to curb waste? And in terms of abuse, can they explain to us how they're dealing with the abuse? Who is abusing it? And what are the plans to ensure that those issues are dealt with? Thank you, Chair. I'll limit myself to those.
Thank you very much, Honourable Letlape. Members, just one comment from my side on specifically on GEMS. So, I mean, at the end of the day, GEMS as a medical fund, if my understanding is correct, uses the income generated by its members. So that's how they set their fees. So they have to use that income, the contributions of members. Then they have to cover their claims, which is basically their major expense item. So people go to the hospital, they incur expenses, and any medical fund, not just GEMS, only works if the amount of medical aid fees being paid, so the income, can match the expenses. And the expenses is the claims, the hospital claims and the medical claims. And if you are in a situation like all the other medical aids are in as well, where your costs are escalating, or you have to escalate members' benefits, or sorry, members' fees with more than inflation, to me, in my mind, that says, well, at the end, there's either one of two problems. So either you are too liberal in your claim structure, so you're allowing too many claims, or there is fraud in the system. So people are stealing, basically defrauding with medical claims, or obviously medical costs itself is escalating above inflation. Either way, the simple way to deal with it is to say, well, if my expenses are going up with 7%, my claims, then I need to increase my members' fees with 7%, because at the end of the day, you need to break even. And the 25% surplus, which is the millions of rands which is in surplus, needs to stay there as a matter of regulation. And that regulation is really important, because when something like COVID happens or any unforeseen pandemic, all medical aids needs that 25%. So the fund is forced; they must have 25% in the reserves. It can't be viewed as money that is there to just use to relieve members. They have to stay on a 25% surplus. It is regulated that way, and that's my understanding at least. So I'm going to conclude by just saying I would also like to understand how medical expenses and medical inflation has played into this, and also what more can be done about the fraud in claims, because those are the areas where the fund can potentially bring claim amount, the expense amount down, because that is only the only thing they can really control, apart from raising fees. Before I hand over to James and the NSG to answer, members, we have to unfortunately be practical. It's now 5 minutes past 12. We're only scheduled to go to 1 o'clock. Members need to get on buses and transport themselves from the different villages and get to the parliamentary precinct before the sitting we have at 3 o'clock. And that's not going to be possible if we allow two more presentations and deliberations and feedback from GEMS and NSG, which can probably take no less than an hour and a half. So I'm going to, while we give
Maybe, Chair,
Honourable
as you'll
Deputy
be,
Minister.
I will want to bring a proposal after your ruling, so that while I align myself with what you're saying, but I want to give a proposal. I want to put across a proposal on GEMS, if you allow.
Yes, Deputy Minister, I'm willing to hear. Please proceed.
Okay. I note what members are raising, and I want to propose to the committee, because many of the issues that members have raised are the issues that the minister raised. Just to take members in confidence that GEMS is delegated to the minister, but from time to time, we have meetings with board members, and I become part of that. There has been recurring questions, whether from Dr. Letlape and many other members, including issues of non-detected frauds or in many other things that are there that are confronting GEMS. So I would want to propose that they respond on all those things, because they have not even shared some of the things with the minister. Where are the frauds? Who are the culprits? What did you do? And so on and so on. We know if it's discovery, they'll say Dr. Letlape has been consistently claiming so much. In 3-4 months, we're able to pay out claims for Dr. Letlape of so much. How possible is it? And they start to zoom into that. We raised it with James and we said, just do 3-4 practical examples where we can start to see which rogue elements of doctors are there who are taking advantage of some of these things, whether it's overstay in hospitals, whether it's unnecessary surgeries, and so on, unnecessary investigations like x-rays and so on, because there may be those elements that they are starting to pick up, and how do we start to look at that? And if that is a problem, how do we then, as GEMS, centralize expensive surgeries and start to say, let's categorize surgeries and start to look at the expensive surgeries and then be hands-on and so on and so on. So I'm saying to the committee, those are the issues that we raised. The second issue, after the march of the public sector unions, there was a lady who was interviewed on TV who said, I'm expected to pay 13,000 rand for everybody. And immediately thereafter, and that's why I left GEMS. Immediately thereafter, I called Jones. Jones is the gentleman from the department who is responsible to deal with issues of GEMS, in salary negotiations and so on. I said to Jones, let's go to PESA. Mindful of the POPIA Act, let's go to PESA and start to say, what is the most expensive deduction? And categorize those public servants to say, those who are paying above, expected whatever, ranges between this and that, and so on and so on. And then GEMS be able to say, the reason why they are on this category is because of 1, 2, 3, 4. Because we are now starting to say, even on our own as politicians, we now have to come closer to this. So I'm saying to the portfolio committee, with respect and everything, allow us between today and next week, Friday, for GEMS to do that comprehensive report, bring it to the minister, and with your time, call the minister. We can even come with the public sector union representative so that they too can be able to take you in confidence on what are the other challenges. That's the first proposal doing, and it will depend on the portfolio committee, so that we comprehensively deal with issues of GEMS. And members must remember, this is the first year of exposure for GEMS to account to Parliament. It has not been coming to Parliament. So it has its own teething problems, but we think we'll get there working together. The second issue, Dr. Rabada is not a public servant. He works for the Mineral Council, which is another entity elsewhere. So he doesn't have PESAL, he doesn't have all those things. But we still have to bring those to the portfolio committee to show in writing that indeed he's not. But we'll also bring the report of the other members on whether they were given permission and so on and so on, so that we bury some of these things once and for all. So that will do as the members of the committee. So that's my fair proposal, Chair, unless if the committee does not agree to it, I'm fine. Thank you, Chair. I'm done, and it will be led by the minister, that delegation, and the presentation.
Okay. Deputy Minister, thank you for the suggestion. Members, there's been another suggestion made on our WhatsApp group as well. And sorry, I'm trying to manage all the suggestions and the forums at the same time. But the feeling is that the same so apologies, members.
I think you're mute, Chair.
Chair, we can't hear you.
Okay, really pass it, Chair.
Chairperson.
Chairperson.
Oh, Kosiam. No, it's a connection problem.
Yes,
Let us
honorable
wait
member
for him.
and Chair and Deputy Minister. I think he will log in again. I don't see him on the platform. So let's just give him maybe 2 minutes. Thank you so much.
Who's acting chair?
Where's the
Mkize. Honorable Mkize.
Ma'am Kize?
I think it's a logistics issue because they now need to leave their parliamentary areas. But let's keep on hanging and hear what's happening.
The chairperson is back now. I think he's going to start speaking.
Members, I'm back online. Apologies. Can everybody hear me? Am I audible?
Yes, you are, Chair.
Person, we can hear you.
Apologies, I had some technical issues there. Members, I'm not sure where I cut out, but I made a suggestion, and you'll see it was made on the WhatsApp group as well. It seems like members are supporting it, that we give GEMS and the NSG an opportunity to just give their brief feedback today. We will have a full day with GEMS in the next quarter as well when they deal with their APPs, and we appreciate that a lot of the questions will probably be answered in more full detail in the next quarter's program. However, I do think that it is important that GEMS and NSG just be given an opportunity now, today, to give their feedback, and that we then defer the DPSA, the other two presentations that was left to our next meeting. Members, can I just see, is there any objection to that proposal?
Yeah. Hello, Chair.
Hello, Chair.
Please proceed.
Chair, I would suggest that we agree with your proposal, but also we start at 9, since there will be 3.
That's a good suggestion. Thank you very much, Honourable Tikana. Honourable Letlape.
Yeah, I was just suggesting that possibly the next meeting be a physical meeting so that we could interact properly.
So that morning.
But I agree with what has been put on the table, Chair.
Before the sun goes. Because you can say you are going to open those windows.
There is somebody, Honourable Kaba, your mic is open. Honourable Kaba, please mute.
Okay.
I say, there we go. Okay, members, it seems like there are no objections. So with bearing that in mind, I'm now going to give 10 minutes to GEMS and then 10 minutes to the National School of Governments to just give their feedback on the questions and the that was given. And then if need be, if members need a second bite at the cherry, we will make space for that at the end so that we will comfortably end at 1 o'clock. GEMS, you have the floor. Please use your time consciously. I will allow 10 minutes. I know there's a lot to cover. Please bear in mind that you will have a full day with us on the next program, but I think there are some important issues which you just need to acknowledge, which will be dealt with. Thank you very much.
Thank you, Chairperson. I must say that we do appreciate all the engagements by the members of the Portfolio Committee. And at this point, I'd like, we've been given 10 minutes. I will allow our CFO to respond. The responses are going to be coming from our CFO and our Chief Operating Officer, Dr. Vuyokola. And in relation to the other questions that were also directed to the Chairperson, I will also probably touch on that briefly, maybe for 1 minute. And then the Deputy Minister has also outlined that in relation to the other members, we will come back with a full comprehensive report so that we put this case behind us. CFO, over to you, Karina.
Thank you, Chair, and thank you to committee members' questions. Chair, I'm going to address the ones in relation to the financial questions. The first couple of questions relate to financial sustainability. How have we managed to pay claims if we received less contributions? So this is where the scheme has utilized some of its reserves to fund those claims. I think in the previous presentation, we also indicated that over the last 3 years, GEMS has used 10 billion Rand of its reserves to the benefit of members to fund these additional claims. The primary drivers of the claim costs, as I've mentioned, is mainly utilization. So the frequency of members using healthcare services. We also saw, in terms of option selection, so members who typically require a more comprehensive option that downgraded to particularly Tanzanite 1, so paying very low contributions and then claiming at the same level as what they previously did on a more comprehensive option. And that has created additional claim costs. And then, of course, we've mentioned fraud, waste, and abuse. The benefit options affected most is Tanzanite 1 by far, as well as the Emerald option. What have we done to address this? We have implemented a number of interventions. Some of those include managed care interventions, looking particularly at hospital admissions and authorizations. We have made some changes in terms of benefit design for the 2026 financial year, and then a particular more focus on fraud, waste, and abuse. And I'm sure our colleague online, Ishmael, will speak to the fraud, waste, and abuse questions in particular. The burden, will this be placed on the members going forward? So the short answer is no. That is why the scheme is intervening and dealing with these challenges head on to ensure that members are not affected going forward. In terms of hospital costs, the interventions here, again, mostly managed care. We also have what we call value-based care, and I think Dr. Vuyo can just provide a quick definition on that. It does assist the member to stay out of hospital and have health care by a number of providers to ensure that the member receives ultimate health outcomes. And then, of course, also preventative care, which plays a very important role to ensure that members don't end up in hospital. The long-term strategy to remain affordable and sustainable in the next 10 to 20 years, some of these include we are looking at some innovative products to be tailored specifically for the need and the affordability of members. And when we speak to affordability, Chairperson, I think what we have to differentiate is the difference between being competitive in the industry or in the market and what is affordable. What is affordable to one member is not necessarily affordable to another member. And the scheme is doing a lot of work in this area to see how we can produce innovative products to address this in particular. We are addressing fraud, waste, and abuse. And then a particular matter that has been raised in terms of legislative matters that we are going to seek guidance on and potential changes, particularly in the area of PMBs, prescribed minimum benefits, where legislation requires us to pay whatever is charged, which exposes the scheme to additional claim costs. And then, of course, the reserves, the 25% required. Many of these things that I have mentioned, Chair, and as you also rightly indicated, has informed the 9.5% increase, in particular, the claims expenditure, fraud, waste, and abuse, and the utilization in excess of what is expected. Reserves held at the moment is just over 18 billion. This is less than the 25% required. So the scheme does not have excess or additional capital or reserves or funds, as was stated. And the funds held is as per legislation of the 25%. Chair, I think that covers most of the financial questions. And the reserves are, as was rightly stated there, for instances of disaster or epidemics, that medical schemes are required to hold that level of reserves. Thank you, Chair. I'll hand over to Dr. Vuyo.
Dr. Vuyo.
Thank you, Chair. Chair, I'm just going to segue and latch on to what Karina said, and in responding to, I think, the disease burden as well, and what are we doing to manage the disease burden. The reality that we face as a medical scheme and including other medical schemes is that the and chair of the committee also touched to say how have medical expenses contributed to the rising costs. The burden of disease comes with an aging population. There are various technologies that come up in the industry. The reality is that the cost of or healthcare inflation has far exceeded CPI for quite a number of years. So it's a lot more, it's rising at a higher rate than CPI. This does then expose us in terms of our claims risk. In terms of disease, what are we doing? Are we waiting for people to be sick before we do any intervention? What are we doing to strengthen our disease risk management programs? We put a lot of emphasis on educating our members on the importance of preventative and screening care, which is offered and does not affect, is offered to GEMS members, and it's designed to make sure that all members have access to that without having an impact on their day-to-day funds that they may want to use. We pay from the risk benefit because we want the members to actually access screening and prevention. There's a lot of effort that is put into education to make sure that members understand that it's very important to go for your regular tests. And those that already have chronic conditions like heart disease, diabetes, hypertension, it's important that they go to their doctors, they do go for their regular tests, and they stick to the medication that is prescribed. We do have ways of monitoring who is compliant, who isn't compliant, and it's part of what we measure ourselves in with regards to how we are performing from a disease risk management perspective. There are wellness days that are held in the workplaces, and this is particularly to focus on health prevention and screening. All the options at GEMS also have extensive primary healthcare benefits to make sure that members take advantage of these benefits and go and get tested before they actually get sick. With regards to the issue of the surveys, and the fact that we have not met the member satisfaction survey targets that we had set for ourselves, but there's also an issue of what is the objectivity of the surveys that we conduct as GEMS, because what we are seeing is not reflective of what members on the ground are feeling. This is a matter that has been brought up to us, and we have committed to working with various stakeholders, including the PSEBC, to find a way of balancing these surveys to make sure that they are more reflective of what the members are saying there on the ground. So this is an area that we are working on. In terms of improving inquiries where members have queries or there's delays in pre-authorization, we have had challenges in terms of the inquiry management processes and the channels that are in place. We have put measures in place to make sure that there are channels of communication that have been added, including establishing a toll-free line so that members don't have to worry about using their own funds when they call into our call center. But we've also had our walk-in centers that have been put in place, as well as our client liaison officers that can actually go to members in the workplaces and assist them. It is an area that is an area of focus that we have realized that there is a delay in a lot of cases when we have to respond to member queries, and it's something that is a priority in terms of improvement. In terms of what is informing the growth, there are various employer groups that have that are eligible for joining GEMS that have come on board, and that informs the growth that we are seeing at GEMS. With regard to fraud, waste, and abuse, I've got my colleague Ishmael, who is in charge of fraud risk management, who I'm going to, through you, Chair, hand over to respond to the questions, specifically the ones around how many active cases are actually have been referred, for example, to the SAPS, what have we recovered and from based on what we have lost, and what is our engagement with HPCA with regard to the fraudulent doctors or practitioners. Thank you, Chair.
Thank you, Dr. Vuyo. Chairperson, we're going to give Ishmael just a few minutes, and I think we're running over time, as you have said. But for the benefit of the members of the portfolio committee, just to give an outline of what is it that we are doing and we continue to do on fraud, waste, and abuse. And I'm going to give it to Ishmael. Ishmael.
Thank you, Chair. Good afternoon to the chairperson, to the honorable members, to DM colleagues. My name is Ishmael Mohapi. I'm the Senior Manager Operations Risk, responsible for fraud, waste, and abuse. I hope I am audible and clear. Chair, just to provide feedback in terms of the figures that were requested by the honorable members around the value of fraud, waste, and abuse. We have in the past 3 years, just on cases that we've investigated, the value of the fraud in that matters were about 268 million. So if I can give just an analysis of just only 1 year of 2025, 2025, we identified about 399 practitioners, and all of them have submitted claims to the value of about 1.3 billion on those investigations that we investigated. And we managed to identify for those 1.3 billion, the anomalies to the value of about 32.7 million. And we are able to recover, that is money in the bank, not the ones that they've committed, about 11.7 million. And we have registered 413 criminal cases with the South African Police Services in the past 5 years. And we do understand and we work with the police, especially in terms of the drafting of charges, making sure there's witnesses. The wheels of justice are a bit slow as we get limited or less number of convictions in our matters because of the delays that I think the pressures that the NPA and South African Police Services have. But we do continue to register cases. And we register cases not only at the Health Professional Council of South Africa, as we have different types of healthcare practitioners, some which are pharmacists, nursing, and we register cases with all the regulatory bodies, which is the HPCSA, Pharmacy Council, and Nursing Council, and Social Worker Council. And in terms of our plans, we have now going to foster more collaboration, because we understand the problem of fraud, waste, and abuse is not unique to GEMS, but it is an industry-wide issue. And the main stumbling block for us, or biggest obstacle, is the collusion of our members with healthcare practitioners. And in that way, it is very difficult to detect which claims are fraudulent and which ones are genuine, because of if two people are colluding, it is quite. Now, in order to detect those, the scheme is now going to employ services of AI tools to detect this fraud, waste, and abuse. And we're going to start collaborating with the employer, with the DPSA, so that more action can be taken against members who are found to be colluding, and work in that respect is going to happen. And but what we want to do, because we believe that prevention is better than cure, so if we can improve our awareness initiative as we go across the country, educating members around the issues of fraud, waste, and abuse. Thank you, Chair.
Thank you, Ishmael. And in relation to fraud, waste, and abuse, Chairperson, I think because the presentation will be quite extensive in that regard, so that the members of a portfolio committee can actually understand the extent to which GEMS is dealing with these cases of fraud, waste, and abuse. I think in liaison with the Deputy Minister and the Minister, we would like to, as a board and with the approval of the board, come and do a full presentation of what is being done, what has happened, how much we have recovered, and how much is still out there at large, and prosecutions and all of that. So that's what we'd like to propose, but we'll talk to the department and then we'll liaise accordingly. In relation to the concerns that have been raised by Honorable Alicia regarding the names of the trustees who sit in the board, and actually raising concerns with the chairperson, who is myself, on the board members who are not authorized to sit in the board. We are not aware of non-authorization of the members who sit in the board in that respect, because the authorization, as far as we are concerned, is not derived from is derived from the departments who have employed these members, and it's a prerogative of that department to give the authorization. And our understanding, and I'm going to give maybe 1 minute or so to the secretary of the board, who handles these matters, to just determine and how they get to sit in the board. But they are authorized by their departments where they come from, but not from from us. Can I give you Marinus to please share brief? Yeah.
Thank you, Chair. Chairman of the Portfolio Committee, through you. My name is Marinus Kruger. I'm the Company Secretary and Legal Counsel. So, permission to work or perform remunerative work outside of the public service is governed by Section 30 of the Public Service Act, which determines that the department in whose employ an individual is must have a policy in terms of which it grants approvals to individuals who wants to perform other work. In respect of the two individuals specifically named, we do have copies of those approvals, and they were granted by the relevant departments in terms of Section 30 of the Act, Chair. I've also been asked to highlight that the two individuals, they are elected members of GEMS's Board of Trustees. How GEMS's board is constituted is half of the members are appointed through the executive authority in the public service, and the other half of the members are elected by the members from amongst the members. So those two individuals are elected trustees and they're not appointed through the executive authority. Thank you, Chair.
Chairperson, we're now handing it back to you. I think we have responded in the time that has been allocated, and we do apologize that it's been exceeded. And in liaison with the department through the Deputy Minister and the Minister, we will be able to come back to the Portfolio Committee again.
Thank you very much. I would then just like to second that proposal and ask that GEMS and the Minister and the Secretariat, that everybody just liaises with each other, that we get a full briefing on fraud and on medical expenses and all of these issues that have been raised in committee in a next sitting, and that it forms part of our program for the next quarter. So I would like would appreciate the coordination between all of the different stakeholders so that we can have that presentation. But for the moment, GEMS, thank you very much for that feedback. And with that, I hand over to the NSG to please give their feedback. NSG, please proceed.
Thank you, Chair. Thank you. I'm going to take the questions. I've asked Dr. Lakela, the DDG administration, to deal with the question on vacancies, but let me deal with the other questions. I've tried to summarize them according to the groupings because some were sort of related. On the ethics course, the members asked around the provinces that have taken up the program. We do have the Eastern Cape sitting at about 4,000 people that were trained, Free State 1,300, Gauteng 8,000, KZN 4,000, Limpopo 6,000, Northwest 4,000, didn't mention Mpumalanga, Mpumalanga 4,000, Northwest 3,000, sorry, and Northern Cape around 700, Western Cape at 7,000. So we see quite a lot of that. We do have even at local government where it's all about the provinces as well, but the number is sitting as 2,500, but we do have a breakdown according to the provinces within the local government. The other question around that was also the category of for example, for senior supply chain managers, we can provide that kind of information next time when we come to the committee. We do have that. I don't have it at hand, but we do try and identify. But there's additional programs for supply chain people to also do programs that are relevant to them, that also promotes ethical behavior within the work that they do. We can share more information when we come to the committee again, when we share more information about the NSG. On the question around the assessment or feedback tool around ethical behavior, as the NSG, we don't have a mechanism directly that we have to check if there is improvement around the ethical behavior. But having worked with the DPSA, they have developed the tool called EMMA, which is called the Ethics Maturity Management Assessment Tool, which is a self-assessment that departments have to go through and implement within their departments and report back to the DPSA on checking whether there's improvement in the ethical behavior within the department. We were part of the key stakeholders in the development of that tool, but it is a tool that is managed by the DPSA, and we are supporting that work. So maybe the DPSA will shed more information around the progress of if they've received feedback on the implementation of that tool. Chairperson, on the question around the impact of our training, we do conduct impact studies. As the NSG, we can request for another meeting where we can share the impact studies. What happens with those? We do assessments for some of the programs before people enroll for that program, during the program, and after. We follow them after they've attended the program for a number of periods with different intervals where we check in with them. Most of the studies take about 2 years to 3 years to conduct, where we can then be able to judge for sure whether there has been improvement in the implementation. But we also rely a lot on the departments doing giving feedback. There's some programs where the supervisors of employees are supposed to be part of on-the-job feedback that then they give feedback back to the NSG. The question around whether with our increased numbers, if we are compromising the quality and the relevance of our programs, I state, Chair, that there is a very rigorous process that we go through in the development of our programs, making sure that they're relevant and that the quality is right. We have a quality assurance unit that looks at the quality of our programs, making sure they're relevant and they address the key gaps that we would have identified through the process of research, where we look at the AG reports, we engage with the different departments as well as their performance to come up with the relevant programs. So with the increased numbers, yes, it does put pressure, but we still have control on the class size to make sure that there is value for those that are attending. So we still limit the class sizes. So between 25, depending on the type of program, we can go up to about 30 to 40 people within a class to make sure they are truly engaged. The open learning programs itself, people are able to do it by themselves and they're able to attend those programs, and as well the quality is truly managed. And we review our programs every 3 years as a standard procedure, but if there's new development as in new legislation and so on, we bring that period forward to try and make sure that we are relevant to what is happening. As and when things develop, we adjust the programs. On the question around our international relations and the way we allow public servants to attend programs that are given by our partners such as Singapore, China, and so on, what we promote is that we cannot take exactly what our partners are doing in their countries. We learn what are the best things, what are the elements that are good, and we need to adapt that to the context of South Africa. What we've started doing now is to create communities of practice for those that have attended these courses to come back and report what did they learn and how are they implementing that learning within their environment. And a question on local government programs. I want to highlight a few that are key. We do have, as I mentioned earlier, the Ethics for Local Government program that is relevant to them. We've got contract management relevant to the local government, bid committees as well relevant to them. And recently, we've developed a program for CFO course as mandated by cabinet to assist with the CFO's performances within local government. These are just a few to highlight, but we do have more. We can do another presentation on all the programs that are available to the local government. We also do collaborate with SALGA and COCTA on the space of local government because they also do some training there. We work together in some of the training that we do with SALGA. I want to state that we are in the process working with SALGA and COCTA on developing the New Gala program for local government. It will, as part of the professionalization, there's a requirement, we will be finalizing that work with them, and then it will be available for those that are applying to be in local government. The other question was on ethical leadership programs that we've done with legislators and the executives to state which legislators we've done this program with. I can report for the 7th administration, we've managed to do the ethical leadership for the legislator program with Limpopo, Mpumalanga, Northern Cape and Northwest, as well with the Portfolio Committee for Public Works and Infrastructure. We've been able to run that program for them. We've also, for the executives, we've had mixed groups with where there is head of departments as well as the executives. We have also done Eastern Cape and Limpopo on those ones. The last question I'm addressing, Chair, is the question whether the NSG is making sure that the SMS that is appointed have got the requisite competencies when they are appointed. I must state, Chair, that is the work of the DPSA. I'm sure they will be able to answer more on that. What we do as the National School of Government is that the Nugela program is part of what we're trying to address, giving them an overview, and they need to understand how the state works. Then when they are appointed, they will do the induction program, whether if they are 13 to 14, they've got an induction program for them that will also look at the competencies that they need to have, and it's assigned to that, and those in 15 to 16 as well, the induction program that we've designed to deal with that. But prior to the appointment, the standards are for the competencies that they need to have are set by the DPSA. So we respond with the programs that we develop to what is already been specified within the competency framework by the DPSA. I'm now going to hand over to Dr. Lakela, the DDG administration, to deal with the questions on vacancies. Thank you.
Thank you, Acting Principal. Afternoon, everyone. Just quickly, the NSG has a staff complement of 238. And out of those, we have 21 vacancies, which is 8.8%. So we remain below the threshold of 10%. Out of 21, 4 are SMS. Honorable Member wanted to know how many SMS. 4 are SMS, and the status is as follows. The post of principal, we have gone, in fact, it's principal, 1 chief director, and 3 chief directors. and 2 chief directors, so it's 4. Principal posts, we have completed all the preparatory processes that are required and prescribed, assisted by colleagues at DPSA. We are grateful for that. And so this week, Minister granted us permission. This week, and then next week, the post will definitely be advertised. We have asked for a slot in the vacancy circular of DPSA. We have a Chief Director, Research and Market Intelligence post. It was advertised, shortlisted. We will soon schedule interviews. Director Supply Chain Management has been advertised, shortlisting, interviews done, whole process concluded. The successful candidate will start work next month on the 1st of April. Director, the last one is Director Curriculum Support and Professionalization. It was advertised. No suitable candidate was found, and the panel recommended that we re-advertise, and we shall be doing that very soon. So it's 4 vacant SMS posts, but as Chair, you could hear, all processes are in place to fill those posts. Thank you very much.
Thank you, Chair. We're handing it back to you.
Thank you very much, NSG. We really appreciate it. Members, that brings us to 9 minutes clock. I will final. Please keep it to 2 minutes because we need to close at our scheduled time of 1 o'clock. I see 2 members' hands are up. I'm not sure if they are legacy hands or not, but I will deal with them as they are raised. Honorable Letlape, is that a legacy hand, or do you want to add something?
It's a legacy hand, Chair.
No problem. Honorable Kolisi, would you like to add something, or are you comfortable?
No, thank you very much, Chair. I'll just take my 2 minutes. Chairperson, I hear when James was responding, right, they responded and spoke about Dr. Rabada, who is now the deputy chairperson of the Board of Trustees. And they say he is not employed by the department. I have it on good authority that he is. And if they claim that he's not an employee of the Department of Health, can they please make provision to this committee of the letter of employment where he's employed? Secondly, Chairperson, they talk about the decrease in reserves, but what they're not telling us is the monies that they pay in Medischeme and Metropolitan for admin, the admin that is supposed to be done and be admin that they're supposed to be doing internally. And maybe lastly, Chair, I forgot my last point now. So it's the Dr. Rabada and the fact that they must and the two they said nothing about the 2 people, which is the 2 board members that I spoke about, which is Koni and Kumal. They said nothing about, and these are the people who have been receiving money from the state. One of them got 8 million and another one got 7 million. And that is defrauding the state I was talking about. And you were stopping me from exposing. Those people, the board needs to explain to us, why are full-time employees members of the board? Why are they members of the board? Because they're not even touching that. They're touching the issue of Dr. Rabada. And I'm saying they must make a provision in the form of an appointment letter where that doctor is employed. Thank you very much.
Thank you very much, Honorable Kolisi. Just a correction, I did not stop you from doing anything. I just merely asked you to please not implicate somebody criminally if you don't have the evidence. I did not try to stop you from asking your questions, as you are rightfully entitled to do as a member of Parliament. And then I just want to say, I do think that GEMS did deal with it. The secretary, who is also the legal counsel, explained that in terms of legislation, and this was my understanding, in terms of legislation, it is not the responsibility of the Board of Trustees to get a trustee's written permission from their department that they may sit on the board of trustees and earn extra remuneration or earn remuneration outside of their primary salary. It is the responsibility of the department, the government department that employee or that public service member works for. It is their responsibility to give that and check that. And it is not the legal responsibility of the board of GEMS to do that. So that was the explanation that was given, and legislation was quoted for it. I think if you are not happy with that explanation, you are welcome to rebut that and put it in writing, and perhaps provide us with the legislation that says otherwise. But for the moment, I'm not going to ask for further deliberation on the issue, because I do think it was covered. But we do have another session with GEMS where we will have a full day session where we will cover most of these issues. So members, I see Honorable Lehlape, your hand is up. I will give you a very quick closing comment before we end the meeting. Honorable Lehlape, please proceed.
Thank you, Chair. I just wanted to bring to the attention of members that in terms of RWAP, which is remunerative work outside public service, if you have permission, you can go and earn outside public service. But if you are a public servant, you are generally not allowed to earn from public positions. So if GEMS entity, those that are earning from public service can earn again. They can pay for your nominal expenses, logistics, etc., but you can't get sitting fees if you are a public servant from a public institution. That is a matter that I hope the board secretariat for GEMS would get clarity on, as they seek clarity on the question that Honorable Tulisha is raising. Thank you, Chair.
Okay, members, thank you for that, Honorable Lehlape. That, it comes back to exactly the same issue that Honorable Telise has raised. And I think what we will do is I will ask our researcher and legal counsel of Parliament to just formulate to us exactly what is allowed in terms of legislation, so that we can all have a clear understanding of it, that there's no misunderstanding of what legislation says. And then when we have that in hand, we can then decide as a committee if the board of trustees of GEMS has the responsibility to check if their members are being remunerated or irregularly. So I will ask for that clarity, that we all are on the same page, that we can all agree on what exactly the legislation allows in this instance. Members, with that being said, I'm then going to move for closing of the meeting. We will then deal with the additional 2 presentations in our next meeting, and we will communicate the new program to committee members after the management committee has just sat down and decided on it. I hear someone's unmuted, but I think that was a mistake. Members, with that, I will then close the meeting. Thank you for your attendance. Meeting adjourned.
I don't